My name is Aisha Haynes, and this webinar is titled Infusion of Virtual Reality into the Classroom, What You Should Know Before You Buy Equipment, led by Dr. David Dawson, a clinical associate professor in the Counseling and Rehabilitation Program in the School of Medicine, Columbia. And David, I'll turn it over to you.
All right, and thank you very much for the honor of being here. If you've not did, if you heard just a moment ago, I actually got started from CTE offering a grant in basically virtual reality and allowing us to set up. So one of the things that I will go and just kind of a blatant ad that if you ever see virtual reality training or to put in for to scholarship and grants, please take advantage of that. What I'm going to go is talk to you a little bit about virtual reality and about how we're kind of doing it. I want to save time to answer questions. Virtual reality has changed greatly since I've been involved in virtual reality. And virtual reality, I've been involved for many years, quite a few before we even got to our lab. I actually have the first virtual reality developed system, the Crescent, before it was Oculus. It sits in our lab at the moment, and I show people because at that time we were running it on a Windows 95 and a sometime I never made it to Windows 10, Windows 7 unit, and it's primitive. It was one in which you had to put the different eye things in, but it's amazing to show how this changes, and virtual reality changes all the time. As introduced right there, we have a virtual reality lab in the School of Medicine, specifically the Department of Psychiatry. Ours is basically open to School of Medicine faculty, staff, students. We're also open up to Prisma faculty and students, saying that we also work in conjunction with education and engineering, and we have opened up ours into other elements. So the idea that if persons want to come from the main campus and visit our lab or try some things out, we have equipment here and you're welcome to by appointment. We also have, as I was just mentioning, the Early Childhood Center. We have another one, the South Carolina Center for Assistive and Adaptive Technology will be reopening starting next week. We're getting it set up there, and then so you'll be able to do some trying out virtual reality equipment right there. You also can do it at CTE. Our applications for virtual reality is basically we're looking at virtual reality from clinical applications of how to use it with persons with disabilities, how to use it with patients, how to use it in training. We're also use it for research, and we also will do it for different types of training of our own medical students, everything from anatomy to arthroscopic knee surgery to about a week ago, we had a group of 4 of them there, and they were basically learning to put trachs in, and we were putting basically traching with that. One of the things that I point out with virtual reality is when people come over to the lab, sometimes people have the idea of the big space. And the advantage of virtual reality, as I say, it's more spaces on the inside than on the outside. And to give you an example of that, I'm actually going to show you what our lab looks like. So what we're showing right now is literally the one of 2 areas. We have 2 specific areas in which we're able to do virtual reality. This is the main one, and if you come in, you'll more than likely find this one. And this right here, you'll notice we have a tape section on the floor. And that is a safety margin, basically, because we'll set up borders for persons who are there. You can't really get beyond that. Your virtual reality equipment stops you working the moment that you try to cross that border. It also is a safety area because of that. I have research students who are constantly monitoring, making sure your safety. We have another one over here on the side. We have basic right there. Also in the back, you'll see a table, and what you can't see is there's actually a clear partition. We have a plastic partition which can separate people, and so persons can work actually from the table. We can put multiple units if persons are setting. I can put up to 5 units on there if I need to at a time. We have, if you see, I have an external monitors that people can look at there. This is actually our small room. And the small room right there is, again, kind of a really enclosed, nice little space that allows for a little bit more privacy. And this one is currently set up with a Oculus Rift in there. So we have another system, another room that's actually larger. And the reason that we don't there, it's actually our classroom also, but we can clear the desk. It is extremely large, and so I can put easily 3-4 persons in there with different types of laptops. Equipment in our lab is we have Oculus Rift S, Oculus Go, Quest 2, Vibe Cosmo, and the new HP headset. We try to evaluate different pieces of equipment as they come up. We also look at equipment that has been discontinued. Sometimes there is still viability when we can talk about this, like someone donated to us a Daydream system. And there are a number of applications, even though it's no longer for sale, you can still pick them up, and for viability, it's fantastic. We have over 300 programs that we basically currently have available. So these programs are a variety of interests for anatomy, pain management, desensitization, relaxation, occupational different types of training. The programs are ones in which are coming up to some of them that we are purchased, some are free, some are demos. I have a number of researchers that work with me, and we are constantly looking for programs, and we are constantly reviewing different areas, basically from medical school to psychology to VR systems, and we test out the programs. If we find one we really like, well, then we put it in our rotation and we put it in our list. If we find some that we don't, again, we mark why we do not like it. And sometimes it is simple as the persons may not know. We have one that we just got, we thought was going to be fantastic. It was surgery trauma. And unfortunately, when we got in there, 3 of us who tried it, and there's a lot of motion sickness in that. The way they did it, practical is good, but it is not feasible. And so it won't be on our rotation list because it'll make a negative view of virtual reality. But we will be offering feedback to the developers to hopefully see if we can go, because it has a really good promise. The reason we're using virtual reality is because that if you've not been in a virtual reality setting before, and I know a number of you have, it offers a lot of things. We tend to go and interact in the world through a lot of, again, sight, touch, there, taste. Although we can't do taste yet, virtual reality is getting to smell, and you can do sight, touch, and sound. Smell is also possible, and is being a number of people are doing it. There's a number of different virtual reality systems there, and my apologies that the slide looks like cut off a little bit, but the most common you see is persons who do 360s. 360 environments are basically having 360 camera. The one that I showed just a moment ago when I did a demonstrate looking at the lab was a 360 environment. I also have the ability on that slide that I can put call hotspots in, and hotspots allow me to, in a 360 environment, to have better explanations. It also can have some limited interactions. But 360s are pretty much static in what they can do. Augmented reality is kind of where it overlays the world, and that's where we see some of the things where you're looking for anyone who plays, the kids played Pokemon Go, persons who are looking at different types of Google Glass, augment there, and it's a way of basically overlapping the world. it never takes you truly through the into the world because you constantly have an overlap. And so if I'm working with someone and if I'm working with a basically person there, we can basically go and I've seen again augmented reality where we can actually have a person laying right down there, and then it can actually map out a grid basically of where structures are. You're supposed to be able to see structures and working with. Virtual reality is really immersion. As you can see from there, it's basically a contained unit in which basically you are in a world. And here, there, some tactile feedback. It truly allows for an immersive environment. It has a lot of advantages when we really want to take someone out of the everyday tool, and I've seen this over and over how closed systems can help. It also helps when I'm doing things like if I'm going to do anatomy, or I'm doing in a setting in which I want a person immersed in a real life setting, then to immerse them into a closed loop versus a AR system. Different type VR systems out there. This is why I have this presentation. There are many. The one on basically right there is Cardboard. You've heard about Google Cardboard. Google Cardboard is actually really kind of interesting because of that. In our medical field, it has some play again. It is one that you can use with a phone system. Usually use a phone or some other type of device. There is also ones in which are tethered. The one that's on the right second, you'll see a virtual reality system with a cord, and those are devices that are usually tethered with a computer. There are a couple different types of ones, the Oculus Rift, the Vive, the HP, and there's also untethered systems. Untethered systems would be similar to the Go, looking at the Quest 2. And so when you're looking at this is really kind of making the decisions. What you want to use, what works best. The first thing I tell people is do not get blown away by what someone tells you you should use. Don't get blown away by the new technology. Technology is a tool. The very first question before we even look at virtual reality is what's the educational objective? Why is virtual reality basically beneficial? What are you trying to achieve here that you cannot achieve in a non-virtual reality environment? Okay, what can or how can it enhance better? So for one of the things is we've been teaching anatomy and physiology for hundreds of years. Students have been learning it through many different ways. Books, their labs. Virtual reality, what it offers is actually a closed system where a person could learn anatomy from a structure with a true automaton right there. It allows a person to go over not only the books, but to refresh things. And so one of the things you know about any type of looking at physiology, neurology, there is a lot to remember. There are a lot of connection. And so to have the ability that someone could come all the time and refresh, the idea of that we can have someone go and before we do a heart surgery or tumor, we can actually do an MRI and we can actually map that out right there. And then they can practice it virtually before they ever get to it. Okay, so there's a lot of advantages to it. So what's the educational one? The other one is, again, how does the virtual reality, because the virtual reality is basically a system in which you're augmenting the environment. There's different ones. It may be a 360, okay? That may be all that's needed. It may be something in which you need more interaction. Or it may be something that you can do with a tablet. Again, what is business? How can you augment, again, non-virtual? What is the important thing of it? The other one is what programs currently are available. Before I buy anything or look at anything, I recommend really looking at what is available. What does it cost? What are some reviews? Also, what technology is available? Since this presentation, we are actually, the Oculus Go is in our lab and has very strong use. So has Oculus Rift, Oculus Rift S. Those are no longer being produced. Neither is the Oculus Quest, only the Oculus Quest 2. That is something to recognize. And one of the things we did was we recognized before Quest 2 and kind of looking at that, we knew that Quest 2 could work from a tethered situation. And so there's a lot of things we had to put in there. What we wanted to maintain from our old VR, and why are we still using it? Again, I said before, I have a Daydream that's currently out with palliative care. And the reason that the Daydream, even though it's an older system, outdated, it's got some outstanding things for, again, pain management, some really nice things for how it fits, the comfort level of it. Plus, it has just this screaming one that I love about meditation guided by a unicorn. All right. How many students are going to use the technology? This is crucial. If you have a class of 200 students, how many systems do you need? How much time is it going to take? What is the pedagogy they're supposed to learn? How are they going to demonstrate that? If it's 360 videos, you can possibly get using things like their phones, cameras, cardboard. But if you're using more intricate, hands-on, then you need lab setups. And so you basically have to really then monitor. We see in this lab right now, no more than currently 4 people at a time, one because of due to COVID, but also because of that, I have a ratio on, especially if people are standing, that for every person who's going through virtual reality, I have a student or researcher who is with them, not only to guide them and get them when they get stuck, but also as a safety precaution. Persons can lose their balance, persons can forget their positioning. And so that person is not only there to help if there's a problem, but more importantly, they're there as a safety precaution so that the person, again, just in case. So that puts 8 people in a closed area. And then where it's located. Depending, again, where you're using this, the location can be crucial. Our areas are not very large. A lot of we do have, though, if we're going to map off 10 by 10 squares. At the minimum is an 8 by 8 square, and that's for any type of standing. For setting technology, it can be smaller areas, smaller located. And then also is who's going to maintain it and clean it. Long before COVID-19, we were already looking at problems that with persons who were bacterial. Persons basically who everything from conjunctivitis with inflammation of the eyes, persons with bacteria in the nose. And so there was a lot on how to clean and how to maintain these systems. We have CDC protocols that we use in which before a person ever steps into one of these units, everything is cleaned thoroughly. Persons then have the ability right there, they have to come in, They have to basically go, and to come into our area, you have to have a temperature anyway, but they have to basically then sanitize their hands. We have gloves, surgical gloves, if people tend to use. I use surgical gloves at all time, just out of just practice and protocol for me. I also have a overlay that goes between the face shield and the eyes. It's like a paper overlay if people want to give a greater protection. At the end of the virtual reality experience, the machines are then taken off and then they are cleaned thoroughly again. And by clean thoroughly means that we know how to take them apart, totally wipe them down there, chance to dry, then put them together. So they're clean not only after, but again, remember, before the person gets back on, we'll clean them one more time. Now, UVAs, we do not currently have a UVA system, although that is something we will be getting in here, and especially within the hospital, we'll have all UVA systems in there. But there's a myth on the UV ultraviolet light. Ultraviolet light is not a cure-all. You still need to clean the technology, even with ultraviolet light. It still needs to be in there with a certain period of time. And so, but it's just one more method. And with that, I'm actually going to stop it here and ask your questions. Brian, you're an expert. You don't need any questions.
Yeah, I do. I've been contemplating requiring students. Right now we do the goggle phone thing, and I've been thinking about requiring students to literally buy an Oculus Go because textbook could cost $150. But when you mentioned that they're no longer available, so you can't, like, if I had 35 students, I couldn't buy 35. They couldn't buy 30. They couldn't find 35 copies of, or sets, or whatever you want to call it, boxes of Oculus Go.
You may be able to find it used. I've been actually searching for Oculus Go's myself. I've been trying to find them in there are different resources. Amazon, you can still find some there, but again, they're not in production, and they've not been in production for about 8 months now.
So how much is the Quest? Or which is the current model? The Oculus Quest 2?
Oculus Quest for $299.
Wow. Okay.
Okay. Yeah. Now the Oculus Quest 2 is $299. There is the HP is $600. The Rift is the Vive is about $600. Yeah, the Go is something that needs to come back. I really appreciated the Go. I love the price of the Go. And I'm hoping that someone comes back and fills that spot.
And it was untethered, right? Because like I said, I was always scared to ask the students, require the students to do that. But when we bought ours at Walmart a year and a half ago, or Black Friday or whatever, I think it was like $100, and that's less than a textbook. So I'm thinking, yeah, I could do that. But now if it's not available, I'm back. I would not, in good conscience, ask undergraduate students to pay $300 for a headset. That's just too much.
And again, it's that one of those. It's not the idea of $300 for a headset for me. I'm the same way as you are. I wanted every medical student, when they came in and M1 start to that, we required them to buy one of the Oculus Go's, much like you would for a headset, because there's so much anatomy programs. There are so many different programs. There's virtual reality. There is a wealth of information. With the Go's leaving, you're right. I have good conscience can't allow that anymore either. I cannot tell to switch to the Quest, even though the Quest is a couple $100 more, and for a medical textbook, $300 is normal. Even for a regular textbook, $200 is there. The idea of how much what they get for their money. and there's not yet enough platforms and development and programs available that would offset it for the student. So if I knew that a student could use this for a number of years, it would also fit a number of classes, then I would have no problem assigning it.
Yeah. Okay. Thanks, David. Thank you.
Yeah. Saying that, Lenovo also just went and announced a possible new, cheaper VR system, and so these things change literally daily. My opinion on the HP, and I'll get there. The HP right there, again, what I offer to everyone is don't rely on my opinion. Come and try it out. My opinion is just mine based on there. We have an HP. I really like it. It's clarity. I like the advancement of some of that. I do not like that it's tied to Steam. And there are some issues that we have with the idea of Steam, just because having a Steam account and privacy with that one right there. We are currently evaluating it. If you would like to try it, please feel free to come and try it. But one of the things I encourage is before you take a look at anyone's, try it out, play with it, practice it. That's what our lab's for. Our lab is for persons there. The same thing, Rob's exactly right. With Oculus, you also need to have a Facebook account right there. Although there is now some workarounds to that. Recently, Facebook has been realizing that that's not a thing, and they're releasing ways in which you could do it without the Facebook account. One of the things Facebook has been really good for me is that I have everything tied to a single Facebook account. Mine is for my USC rehab account. And so all of my systems work from a very closed loop. And there's no one in my loop. And so it basically works on that. And until Facebook gets an enterprise system, that seems to work fairly well. And so I'm currently can run as many as 13 systems, because that's all I have, at the same time, all using the same account. For a Vive, it would be Viveport. One of the advantages of an Oculus Quest is that it can be tethered. And by tethering it, you can tether it to a computer, and then it allows you to run an Oculus Rift, all the programs with the Oculus Rift. It allows you to run Steam. It also allows you to run Viveport software. And so we do a lot of basically tethering, and we'll have the advantage of tethering. The disadvantage of tethering, you still need to have a laptop. And not just a laptop with at least a 1060 card in it, although you cannot get 1060 cards anymore. So 2060, 3060. And I was just pricing some the other day. I'm looking at purchasing a number of them for about $1,400. So a tether, a link right there, cable, a Oculus Quest. So Oculus Quest, and I'll get the one that will run about memory. So I'll get about $300 for a Quest, about another $1,400 for a laptop. I don't use the link cable. I actually use another version that's about $20, which I run fine with. And so again, for under $2,000, I can run a pretty dramatic system that could be a standalone or tethered to a computer. Okay. So one of the reasons we have our lab is, again, there are a lot of questions to it, and there's the main thing is to remember all technology will be outdated. That's just the way it is. But can you have applications that will stay for the long period of time? So for Oculus Go, before Oculus Go, and they are no longer bringing new ones up, but there are people who make it. There's ways, what we call sidebar, that people can bring in. They're still making it, and you can still load them on. We downloaded and basically put on our library all the Oculus Go software. So we can still use the Oculus Go for many years until they slowly start to deteriorate themselves or they're picked up from another one. So that's something to really know about. Again, if people in doubt, again, I have the original Oculus Crescent in my office or lab, and you can see what an old one looks like. All right. You really need to know what you want to do. And so some of the things that we're, again, feel free again to ask questions or stop me. Again, we're using it for a lot of education, training. We're doing a lot of allowing people safe areas. So we are neuropsychiatry here. We also work educator, person with disabilities. We also do a lot with residents. And so different areas, simulation lab, safe areas to train, safe areas to practice, safe areas to build skills. Telehealth. Telehealth is one of the things in which really is there. There are, now you can use it and where I can have avatars and where we're having Facebook. I have one of the things that I love using, actually something called Big Screen, which is a free software. And what Big Screen does is it allows me to work with 8 people. And we all have avatars. We're in a central room. The great part is we can all share our computers at the same time. We can put up different displays up. So we don't have to do single or share units where like we do right now where only one person can have the time. I can have up to 3 people and they all have their different things running. And it really works when we're brainstorming there, if I'm working with different teams and we're doing things in the moment, especially if we're working on different things at the same time. It allows me to work from home, different areas. Again, it's just a new way of doing this. Therapeutic tools, we use it for anxiety, phobia, post-traumatic stress disorder. We're using it for persons who help with public speaking, anxiety, you name it, we're coming up with it more. And they're tools that are, what's interesting is a lot of these tools that I'm using were not really developed for this. And so some of the, especially when I'm doing things for physical rehab, occupational and physical rehabilitation practice, I'm using games. And games in which I've kind of run research, looked at, like I told you about the climbing wall for mindfulness, climbing wall for there. Substance abuse treatment is very big, which we're using that. Again, we have a lot on relaxation, and I think we'll get there. Okay, there we go. Socialization. Working with persons who have anxiety disorders, persons who may not work with competitive play, helping people know how to go and work in partnerships. So we do it with self-esteem building. And so we have areas in which persons can do it together. Immersive experiences, we already know, again, helping person, I've talked a little bit, helping person experience what it's like to, again, have Alzheimer's, what it's like to have a visual disability, what it's like to have different types of things. And so you can recognize or a family member can experience this before working with populations. Mindfulness training, we do a lot. I have a lot with mindfulness training of different ones, to everything from guided relaxation to meditation to even my unicorn meditation, which literally is a unicorn. It's more mindfulness, but it does guided meditation, but you can feed it candies and stuff, and it's just a scream. I love it. We do that. We have also critical thinking. We have ones for critical thinking that we help, again, foster that, to think out of the box, to kind of put things together, to do advance, talk about advanced formulation and different ways for logic. So we have health and fitness. We're doing a lot with health and fitness. Actually, we're also doing a lot with smart watches at this moment and smart devices. And so we're not only doing where we're doing health and fitness, we're actually keeping track. And so I have blood pressure cups in my lab. I have different ways to record vitals. And that wasn't as natural as stopping there. What was more natural was putting a smartwatch on them and then really taking a look at their vitals there and recording their vitals as they're doing things. And so I can see when's anxiety level, I can see how much their heart rate's going up. I can get a buzzer when the heart rate's going up a little more than I want. And so we've been collecting data on that. What's interesting is we've also been finding out we're having a number of smartwatches that are really accurate, and we're finding those as low as $25. Okay, so we're really kind of looking at that. Yes, keep tracks there. I use one that's called Hollow Point at the moment that I love. My students don't. And that's also one where you're moving, but it's with archery. And so Dance Collider, Beat Saber is the favorite. If you ever come here, we actually have a board which we look for. You can have who has the highest competition and who has the highest number, and people compete for that. So there are a lot of different ways to get in there. Health and fitness, again, we have Tai Chi, rock climbing, many different ways that we work and simulate. Again, especially during COVID, especially persons who've been locked in for so long, we're looking for other ways to get people working out, persons to get people who may not be in the gym, persons which we can do it and then share information. Mindfulness is not just meditation, but is about being focused there. One of the most interesting ones is called bait. Bait is a fishing one, and people think bait is trivially boring. It's amazing how mindful it is, and how many people who never thought they'd enjoy fishing in their life have gotten in there and they've just stayed in it and they've just loved it. Drumming, if you're into drumming, there's drum heroes. There are so many things. Breathe for Peace is a great one because it is about relaxation and mindfulness, but it's on nonverbal. So I can use it with other languages. I can use it with persons who, again, nonverbal autism, again, ways of doing it. One of the things that I will say, again, we're an education institution. We do a lot here, and so we have to really look, especially at anything there, it has to be accessible. And so if I'm requiring anything to students, I need to make sure that it's accessible for students with disabilities, or how to make it accessible. It's no fun if someone's in the virtual reality and they're describing it to a person who's blind. So what is the purpose of it? How are we using it? What are we doing it? And so we're looking more and more at virtual reality. And so virtual reality I've already using for voice recognition, screen readers, magnification, white noise, video enhancements. There are a lot of ways that I can use virtual reality as assistive and adaptive technology tools that are just phenomenal. But there's also ways in which we can bring it in to help with reading there, math, and how it can help with different ways of understanding. If someone can't understand calculus, then I take them into, let's try calculus 4D from a virtual reality point of view. If someone has a problem with reading, then I say, well, let's read it a different way. And so other alternates to do the same thing. So when we're doing this, one of the virtual realities is always looking at, we really need to look at, I always make sure that depending everything that I do, I use a cane. And so I'm very limited, and I don't do a lot of standing other than hollow points in there, and I still do it because it's good for me. But everything I do is setting. And so we do a lot of practicing of what's setting, what's not. If we're making our own, and this is what we're taught about, we can make it very high. If I'm hiring for anyone, I want to see if there's closed captions. I want to make sure that there's captioning involved for their hearing. I want to make sure everything's involved, that it's easy there, that everything has easy accessibility. Okay. I like things in which they're sensors. If we're talking about that is something hot, then we also want to have audio, descriptive audios. Although there are some really neat museums out there in which, for like the color of red, they'll have heat, okay, where there's temperature. And there are some really neat ones there that how people have been able to manipulate things like temperature there or sight with not only descriptive setting, but also there basically Directional. I love virtual reality because the directional noise prompts you to look there, as well as you can have cues that says look around or there to the back. Color, how you can adjust it for persons with color blindness, how you can adapt it, how you can adapt the font. And then for some persons, multiple accessibility. One of the things that we have, and I'm going to up there, is Unity actually provides some thing for developers in which it allows toolkits, and what it allows you to adapt as you're developing this for persons with different types of limited vision. And this is a free one that's already on Unity in these kits, so there's no reason that persons can't put these on anything they develop. I'm going to tell you that there's far more that I will encourage you if you want to know more of that. The biggest I'll tell you is join the virtual reality group that meets monthly, again, at CTE.